Here is a cool part of my job that I'm just realizing I've never talked about. I get to meet and talk with many people who are 100 years old or more. And I take that for granted. I forget that most people don't get to meet a bunch of people who have made it to 100. So the oldest patient I've ever taken care of was 109. And the oldest patient that I ever have taken care of who could walk, talk, and basically live independently was 106. 106. Whenever I get to do a hospice admission on someone who's 100 years or older, literally the whole admission, all I want to do is look at pictures and talk about their childhood and talk about their life. I want to know about their retirement. What have they been doing for the past 100 years? Now, I will say many people who are 100 or older aren't alert and oriented and they can't really tell me, but many can. And I just love talking to them. And they usually love talking to me, usually. Sometimes I'm probably a little overwhelming. The main thing they've said about advice to give because they're 100 and have a bunch of wisdom is don't work your life away and don't worry what other people think. Hard to do, but good to know. Also, I should note that anyone that I've ever admitted onto hospice that was 100 years old or older was happy I was there and was ready to go. They're sign me up. When can I leave? Meaning die. And I'm ready. Let's do this. Most of them are nope, I've lived my life. See you later. They also say that they feel like they've lived several lifetimes. So thinking about their childhood and then when they had a family and then raising their family and then retirement, all of those things felt like different lifetimes. Because if you think about it, they retired, 60, 65? Then they had another 35, 40 years of a whole nother life. So it's always really, really cool. And it's a part of my job that I never talk about. I get to meet and talk with a lot of people who have made it into their 100s. It's amazing.